Hello, this is Dr. Gay from First Look MRI, and this is a 38-year-old female who complains of sharp stabbing pains in her knee when she walks downstairs. And on this axial view, we see her kneecap. We want to look at that patellofemoral compartment here, the anterior knee joint. And we see that the kneecap, along the back surface, there's intermediate signal here, this area of gray signal or intermediate signal. This is the cartilage. It looks nice and thick and normal, so there's no patellar cartilage abnormality. The cortex is the black line. That looks normal, so that looks good. Now on the other side, the femoral side, this is called the trochlea. We see that there is loss of cartilage. Right over here, there's full thickness loss of cartilage. We see white fluid. Here's some fluid, and the fluid comes right up to the cortex. There's no cartilage overlying that. So full thickness condylar erosion, a bare area here, and the bone or the cortex looks a little irregular. Maybe a little bit of spurring here as well, so some mild arthritis or patellofemoral erosive disease here, and that definitely could contribute to pain going down steps. But she also has a couple other findings. One is back here. This is in the posterior knee. This is her posterior cruciate ligament. This is her anterior cruciate ligament. They're right together. And along the back of the PCL, we see this gray area, intermediate signal, and this is localized synovial inflammation. Rather than fluid, which would be light bulb bright, this is intermediate and is fairly uniform and homogeneous. If we look on this sagittal view here, looking in profile, this is the same area, and it is intermediate on this view. This is a T1 weighted view. If we put up this view here, which is similar to this is a proton density fat suppressed sequence, and we see the same area here, this foggy area of just intermediate signal. So again, we would call this localized nodular synovitis. There's actually a few different names for it. Sometimes they reclassify names. Some people will call this PVNS, pigmented villonodular synovitis, because this is a subtype of that entity, and now that's been renamed. Now they call it tenosynovial giant cell tumor. But the important thing is that we know this is not a tumor, it's not an infection, it's not a cyst, even though it almost looks like a cyst. This is a region of localized synovial inflammation, localized synovitis. So if we call it nodular synovitis or localized nodular synovitis or PVNS, we're all calling it the same thing. But it's homogeneous in signal, very common in the knee. A lot of times it's in the front of the knee, underneath the kneecap in this area. Sometimes it can be back here, but it is usually intermediate in signal and uniform. Some of the other forms called PVNS can have areas of low signal hemosiderin in them, and it will appear either irregular low signal, a foggy area, or an area that looks like a loose body, just a lobulated area of low signal. And then we call that PVNS when we see a dark, loose body within. This is again a localized form, just a little area here. The patient also had another area right here, a little area looked like synovial inflammation, localized synovial inflammation, and that's it. So they can go resect this, and the patients do well. This will cause fullness in the knee and knee pain. And this patient is unclear whether her symptoms are related to this patellofemoral disease, with the erosion and some reactive fluid. That is probably the main thing, but this definitely may contribute to some of her symptoms. And that's it. Thank you so much.